So I'm just going to be briefly speaking through the lapel mic before I hand it over. So I'm really, really pleased that we've got a fantastic range of speakers today. We've based the topics of the talks on the sorts of inquiries that we've been getting in, and we've been trying to focus the speakers that we've invited to match the sorts of things that we feel are kind of some of the greatest needs amongst our community. So I'm really, really pleased to first introduce Dr. Andrew Stanfield, who is co-director of the Patrick Wild Centre at the University of Edinburgh, as well as an honorary consultant psychiatrist in Edinburgh. And also Andy is overall a lovely person and great friend of the Society and the Fragile X community. So I'm really, really pleased to introduce him to come and speak a bit about Fragile X and ageing.
That's fine. I talk quite loudly anyway, but if you can't hear me at any point, then let me know. Is this okay? Moment, fine. Okay, thank you very much, Becky, and thank you very much for the invite to come down and to speak. I've been at a number of these meetings before. I recognize some faces. I usually, or quite often, talk about the work that we do that relates to kind of our biological understanding of Fragile X and potential therapies and things. But Becky specifically asked me this time to come and talk about aging and adulthood and what we know about it. This is not an area that I have done myself a lot of research in, so I'm really presenting sort of a bit of a summary of some of the research that we know from other people. And then I do work with adults with learning disabilities in Scotland, in Edinburgh, and I'll just have a few kind of practical points. I don't think I'm presenting anything that's particularly rocket science. I think often some of the best information about aging comes from speaking to each other and other families and people in the society who have contact with many, many people with Fragile X syndrome. So, you know, yeah, I think that's that kind of peer support and things is I think, and I'm sure a lot of you agree, is something very important. Before I start, I just want to highlight this, partly because it just came out and got published like a week ago or something. This is written by a colleague of mine, Andrew McKechnie, along with the other people, the other authors there, Angela Iris and Mandy Allison, who's a GP in Scotland. And it was published in the British Journal of General Practice. And I'm just really quite pleased with it and proud of it. It was done in collaboration with the Society. In particular, the MacDonald family, I'm sure many of you know, but it was, and it's not a long piece of paper, it's not a long paper, but the big thing is that this journal goes to pretty much every GP in the UK. So there's a page, 2 pages about Fragile X, which is going out to all of the GPs, and it relates to Fragile X itself. It's got some information about the pre-mutation, and just some information about just very basic things that we would hope GPs need to know. So we're just really pleased that it got it out, and I'm just basically slightly boasting, I suppose, but highlighting it to you all. It's also free. We've paid so that anyone can access it. You can go to this, and it will be, you can print it out, and that's fine. So adulthood in Fragile X. So what I'll talk a bit is about what do we know, like I say, from a research perspective. The answer, I think probably most of you may be aware, is not a lot. There's not a lot of research that's actually been done in this area. The vast majority of work in Fragile X syndrome is done in children, and there's some studies which I'll talk about which have looked at adults, but there's a gap. There's a bit of a dearth of research information about what happens as people get older. Fragile X is not alone in this. This is one of those things which is we're increasingly aware of across lots of different research areas of neurodevelopmental conditions like autism and ADHD and intellectual disability. What is the longer-term follow-up like for people? So, but I'll present what there is, what I can find, and then, like I say, I'm just going to talk very briefly about some very practical things, which I suspect are things that people contact the helpline about, and it's just to highlight them that they're important things to think about. So I'll talk first of all about functional abilities. What do I mean by functional abilities? Activities of daily living, the things that people have to do to be able to manage for independence or manage easily in the community. And they can kind of be divided into personal activities of daily living, looking after yourself at home, eating, dressing, washing yourself. They can divide into domestic activities, things like cleaning the house, tidying up after you, and so forth. And then kind of activities in the community, getting out and about, managing yourself in the community, keeping safe, and so forth. And so what do we know about functional abilities as we get older? The first thing, I want to dispel this. Don't take a picture of this slide. Please. This was an article that came out in what's called Spectrum newsletter, which is an autism research newsletter. And it worried people. Its coping skills decline with age. And it was based on a piece of research that didn't really show that. And so that's kind of why I want to mention it. And it has been corrected within the text of it, but there was a few people, Jonathan Cohen from Australia, who's a big Fragile X involved researcher and clinician who's got a son with Fragile X, wrote very quickly to them to ask them to correct it. And, it was based on this. This is a very good study, and what it did was it took a measure of what we call adaptive behavior, which is on this axis of this graph, and it looked at how it changes over time in people with Fragile X and how it changes in people who don't have Fragile X. And so the bottom line is Fragile X, the top line is people who don't have Fragile X, and it looks like it decreases. So that's what this article was kind of based on. The problem with it is that this isn't what actually happens in typical people. We all gain adaptive skills over time. This has been what we would call normalized to not change. So basically, this line, if you took the raw scores, or the sort of natural scores, it would go like this, it would go right up. And this line wouldn't go up as much, but it does go up. So people don't lose skills with age. Coping doesn't decline with age, but people are probably slower at acquiring some of these skills. It takes longer for people to do some skills people don't acquire. But they do acquire some, and they do keep acquiring them over time. And a really good example, and I'm sorry, there's a lot of graphs in the first part of my presentation. This is just a summary of that. They don't acquire them as fast as their peers, but people with Fragile X, they don't lose skills. It's not that there's a kind of very big regression or anything like that. They do continue to acquire new skills throughout life. And anyone with a child or an adult child or a younger child with Fragile X will know that. People don't stop learning throughout life. And a very good example of that comes from this study. This is part of the Our Fragile X World group of research. It was done in the US, led by a man called Don Bailey. And this was a big study. It is US-based, so it's not necessary that we can bring all of the results over to the UK, because obviously there are differences. But certainly this first set, I think we can. They sent questionnaires out to families about people who had a child, at least one child with Fragile X. And they got information back on over 1,000 men and almost 300 women. And the age range was between 1 and 62. So they sent lots of questionnaires out. They got lots of really valuable information. And one of the things they asked about were these daily living skills. And what they've done, which is really nice, particularly for this sort of thing, is they looked at them in groups by age. So they kind of said, okay, we had 200 people between 1 and 4, what could they do? We had 500 between 5 and 10, what could they do? And they grouped them by age. And then they looked at all these different daily living skills. I won't go through all these graphs in detail, but it's just to give you some idea about the sorts of things they looked at and what they found. So they divide it into males and females. And as I say, they divide it by age. 1 to 5, 6 to 10, 11 to 15, 16 to 20, and over 20. So they didn't follow these people up for 20 years. These are different individuals in each of these groups. But it gives you some idea about the level of functional skills that people have at different ages. So they looked at communication, for example, and so I mean, the general, like I said, I don't want to go through each of these in detail, but the general pattern is one of improvement. People pick up skills. This is the percentage of people who can meet this skill. And it goes from using single words or signs to engaging in a conversation. And I mean, then there is a development of this in all children and adolescents. And they probably, like I say, they develop faster. But people with Fragile X continue to develop right up through adolescence into adulthood. You've got more people acquiring these more complex skills. And that's the same in females as well. Obviously, the females start at a kind of higher baseline because they're often less severely affected. So this general idea that by the time over 20, about 60% of people with Fragile X syndrome will be able to engage in a conversation, compared to if you have a 6 or 10-year-old, it's about 30%. So these skills continue to increase and improve over time. This is another communication one. This is about just pronouncing words clearly, speaking at a normal rate. I hope I'm not going too fast. Speaking at a normal volume. And again, it's the same improvement over time. And I can go through all of these. This is reading. Now, most people don't learn to read books that contain new words or concepts. Only about 1 in 5 do. But even that kind of continues. But you see this general pattern is of upwards. People tend to plateau at a certain point, but not for everything. Washing, daily living skills, learning how to wash yourself, using a hairbrush, cleaning your teeth, caring for your bathing without being reminded. I wish my children could learn how to do this. It continues to improve through life. And it's the same, like I say, my kids do not do all of this without being reminded at the moment. And they improve too, and people with Fragile X improve. So it's not that people lose function or lose skills. People continue to learn skills throughout adolescence and into adulthood.
Just go back to reading.
Yeah.
It appears to be a slight decline in the over 20 years bracket for some of those parts of it. There's obviously a huge range in age, 40-something years between the youngest and the oldest one. Is that decline or lower level not down to teaching methods of experience?
Yeah, it's possible. One thing which I'll say later on, it's probably not down to things like dementia and people losing skills in that way. So it's possible. I mean, that sort of difference could just be by chance. You know, that little kind of with the reading more than anything else seems to plateau, and I think that's because people don't really get taught how to read much once you get out of school. There isn't really that sort of focus on these kind of things. So it might be. But you would assume and hope, and I'm not an educationalist, that the methods for teaching people with additional needs are better than they were previously. But like I said, I'm not an educationalist, so I don't want to comment on that. So someone at the back has a question.
Yeah, so just going on from that, so my son's 15 at the moment, we've been working in school around this, and we found out that there's things that they haven't been necessarily in the DAC which are specific to Fragile X. So they're now starting to do some of their stuff, and we're looking at a change of placement to a more practical-based way of learning, but where they do reading as well, but it's functional and do things that we like to do. So given if we change how we try to teach them, and then could we defy that role? If we give it as 15, or we still expecting him not to go?
So I don't have an answer. If you have, I can't tell you that it will definitely help or not help. I am a big fan, though, of teaching people practical, functional things, and there is research, which I'll talk about, to show that that's probably the most important thing. I think if you teach someone, you have to adapt to the way that different people learn, and I think there is, like I say, I don't know, I'm not an educationalist, but trying to teach everyone with the same method, particularly if your child has Fragile X, they might have different strengths, profile of strengths and difficulties to other people. It's not likely to be as effective unless if you can tailor an educational approach to someone, it probably is. So and it is an educated guess, not that educated, it's a guess really, is that you probably could, but I couldn't tell you for sure. I am a big fan of practical things. I think there's one of the things that people need to think about in curricula is about what are the skills that people need to know and need to learn, as opposed to trying to focus on. I've had conversations with school teachers about things like grammar and so forth before, and I thought, well, actually, they need to communicate functionally, and that's what you want to aim at, first of all. So it is, depends on different children as well. So yeah, like I say, I'm not going to go through all of these. Toileting, dressing, all of these activities of daily living improve over time and into adulthood. And people keep acquiring skills. Eating food appropriately, eating at a normal pace. There's still a significant number of people do struggle with these things. I mean, I'm not here to say, everybody manages to do all of these. You can see there is still, 60% of people sort of eat at a normal pace. 40% still will eat probably too fast. So, there's still significant numbers of people struggle, but it does has a tendency to improve. So, functional abilities tend to improve into adult life. If you have a young child with Fragile X, they'll keep learning, and I think it's a reason to keep trying to teach people and keep trying to support people and help them to develop skills throughout life. What would be really nice, and I think you kind of suggested it'd be really nice to know over 20 whether or not those graphs continue to go up, or whether we do see a plateau in that sort of 20 years onwards. We don't have the data to see whether actually people keep acquiring more and more and more skills up till 50, 60 years old, etc. There's no reason to think people wouldn't. We all continue to learn. We do forget things as well, but we do all continue to learn throughout life, and we can all still learn new skills as we get older, and there's no reason why that's not the case for people with Fragile X syndrome as well. Independence. This is another one from our Fragile X world. This is harder to bring over to the UK because it's very American-based. Their system is different, so it's quite a different sort of. They have different educational systems. They've got different medical systems. They've got different social care systems, etc. So it would be really interesting to know this in the UK about what happens. As people get these functional skills, how do they progress towards more and more independence as they get older? I did have loads of graphs, and I decided to cut them out because I thought everyone will just fall asleep if I keep presenting graphs and skipping through them. This is what they found. They found most people, as adults, live with their parents or in supported accommodation of some form. 10% of males lived independently. Okay? Now, that doesn't mean, you say that 10% of males, that means that 90% needed quite a large amount of, I think it was moderate to high levels of support within their kind of accommodation, or they need it from their parents and things. So, like I say, the system is a bit different there. They have more group homes, I think, as well for adults and so forth. So there isn't the same model here as we have here of homes. Certainly a lot of the people I work with live in their own home and they have support coming in, or they have sort of support maybe living in and things with them. So, but the vast majority of people will either live with parents or live in some kind of quite highly supported environment when they're older. 60% were in full or part-time employment. I was surprised at this. This is a high figure. I don't know if this relates to the States and the way their lack of, I don't think it was from the States, but the social care is different. There isn't the same kind of support nets and things sometimes. But they had quite a high level of people who were actually working, and they do break down the type of jobs that people were doing as well. So 90% need some kind of support. I don't think anyone's surprised about this. People are going to carry on needing support over time. But 80% of people have what they thought of as meaningful friendships with other people. And over 90% had at least more than two leisure activities that they did and that they enjoyed taking part in. And overall, about 40% of people had what their parents described as moderate to high levels of independence. Okay? But there's still quite a few people who need quite a bit of support. Females, all of these figures are higher, as you would expect. There was quite a few who lived in their own home, who were married, who had quite sort of relatively independent lives in that sort of way. About 60% though still needed some kind of support from families. Lots of people with friendships, lots of people with independence and things. And I think what they find that's kind of interesting, and this is one of the reasons why I'm keen on learning functional skills, is that for men in particular, being able to do more of those functional skills meant you were more likely to be independent. This is partly why I said this is not rocket science. You know, I mean, it's not something that, it sounds very obvious. If you can do more for yourself, you're more likely to be independent. I think that is something that we need to make sure is kind of remembered, though, and when we think about what sort of skills and things that people focus on, it is thinking about trying to get those day-to-day living and functional skills will allow people to be able to do more independently as they get older. The other thing that they find, I mean, they didn't look at everything here in terms of predictive factor, but the other thing they found that having leisure activities predicted friendships. Again, not rocket science, but I think it's one of those, I'm a big fan of, like I say, learning functional skills and having meaningful activity for people that they enjoy doing, that gives them routine and structure, but also gives that sort of option for contact and friendships. There's nothing about the quality of these friendships, but these are families who felt that their children had what they called meaningful friendships. It was slightly different for women, I think because the functional skills were higher at baseline, sort of learning some interpersonal skills and being better in that domain was better in terms of independence. And women were more likely to have jobs, and that was where they tended to get their friendships from, which again makes sense because they're just more likely to be employed because they've got less impairments. I suspect that for women who are more severely affected, it's probably more like similar to the men. Okay, so,
Sorry.
yes?
With the employment, are they almost like sheltered or is it?
It doesn't give a lot of detail about it because I looked through to see that because I thought, is this sheltered? Because 60% is very high, and I suspect they probably asked. They give details of the jobs. I suspect they probably asked what people did, but they didn't ask what support they needed to be in that employment. I'd be, just generally speaking, working with people with learning disabilities, I'd be amazed if 60% of the people were in independent part or full-time employment, because that's not the case. So I assume it's got varying degrees of support within it. But there was quite a lot, I mean, even out of that, I didn't put it in here. I think it was 20% were in full-time employment. You know, so it was quite a high number of people were actually doing pretty close to a 9 to 5 most days of the week. So, and,
I just wondered whether it's actually a sort of 9 to 5 job where they're being paid and a 9 to 5 job.
so they talk about that they get, that there's some kind of, that there is something about they get some kind of pay from the job. It's not sort of a voluntary activity for these things. So I think they may need support, but there is definitely something about that they gain something from the job in terms of financially. I do wonder, the systems are different very much, and I do suspect that there's something about people maybe needing to work more, I suppose, or something. I'm not, yeah. Like I say, I struggled, I did look at it in quite a lot of detail to try and find out exactly, but it's not entirely clear. I suppose for me the message about this is that people need support, but lots of people manage to do things as well. You know, and there is a reasonable degree of, I suppose, that kind of, people who are parents of younger children, optimism about, yes, they're going to need support. Everybody knows that. You'd be naive to think anything else. But actually, they do manage to develop independent activities and living in quite a few sort of moderate degree of independence. Yeah? Yeah. Mm-hmm.
So we have done a survey. We're in the process of, it's a master's student that did the survey for us, but then that master's student's left the UK. So we're in the process of trying to analyse the data sort of without our hands at the moment. But we do have some information. We will be publishing that once we get available. And we'll put it in the feedback. It's a very similar survey to the US survey. So it'll be sort of be asking people a little bit about employment. So they live in.
Is there an age range for it?
So we've done it, we asked people over the age of 18.
The biggest thing, everyone gets lots of things to do. I'm sure you have, there's people like me and researchers, and there's surveys and things. I mean, we tried a number of years ago to do something like this, and it was just people struggle to find the time to fill them out. They're quite complicated, long things and stuff. So, but there is a need. I think there is a need to try and understand within a UK context what happens to people. So I don't know how many responses you got.
I can't remember the exact number. It's over 100.
Yeah,
So
so that's good.
Not too bad.
Yes.
We ended up, one of the difficulties with researching with adults is around consent as well. We ended up doing an anonymous survey to sort of help move that forward. But conducting research with adults generally is more complicated, which is one of the reasons why you see less of it.
It can be hard to actually get to know who you're sending the letters out to if you don't know the person themselves. Ethics committees asked all these sort of things. Sorry?
So isn't part of the problem that actually Fragile X has only really been discovered relatively recently?
I mean, that longitudinal study, I mean, this is, all of the stuff I've kind of presented are kind of snapshot kind of things. And you're right, to do what we would call longitudinal, long follow-up studies, if you want to see how things go for someone over 20 years, you've got to spend 20 years doing that. And so, but the society itself has been running for a long time. But there's two things. One is that, yes, there's not a huge amount of time has passed in some ways since Fragile X was discovered. The other is, you have to have someone who's prepared to sit down and go, I am going to start something now, and it may not bear all its real fruit until I am 73 years old. You know, and there is, and academics don't think like that. I think societies maybe can, albeit there is, you know, but, I mean, we do, and there are people who are doing longitudinal surveys and things, that people do think like that, but that's one of the reasons why there's not. I will present some really nice longitudinal, some follow-up data over 8 years that Hayley Crawford and Chris's group have been doing, because there are people who are doing these kind of things. But So, how does behavior change with age? This is something that lots of people sometimes want to know. This is something that we don't have clear answers for. This was a piece of research done a few years ago, just looking at various types of behavior. This is in the adolescent age. This extends into young adulthood. And they found things which I think, we see or think about clinically. Adults who have got Fragile X syndrome aren't as hyperactive as children, People do, as happens with all children, people do tend to settle down or calm down a bit over the kind of teenage years and into early adulthood, which is that graph there. They also found slight decreases in irritability or agitation. Again, people tend to calm down. I think we need to know more about what happens further out from that at that point in time. And they didn't find massive changes in anything else too much, to be honest. The things, stereotypy is kind of repetitive behaviors and things, which maybe changed a little, but not particularly. Lethargy didn't change over teenage years, which, anyone who has a teenager will know that it's a big issue. We need to know more detail about what happens in adulthood. And this is important, it's hard to do a talk about aging and be positive, because aging for all of us can be difficult in some ways. Some things are good, but some things are not. And it's important, I don't want to stand here and say everything is easy as things get older. Some things do get easier, things do improve, agitation, irritability do tend to improve, but some things do tend to persist. This is the study I was just mentioning, Chris Oliver, Hayley Crawford. Hayley presented this at a conference, I was at yesterday or the day before, presented it much better than I'm going to now. This was done through the society, I think, and they looked at aggression and they looked at self-harm. So they looked at self-injury, not self-harm, self-injury, I should say. And they looked at it over 8 years. So that's not a long time, but this is a kind of follow-up kind of study that you were kind of asking about. And, what they found was that actually there is reasonably high levels of persistence in these groups. That, you know, out of there, actually, I've got the pie charts a bit clearer. So they had looked at 79 people over 8 years. Out of those 79, there was a fairly high proportion just did not show aggression, and about 50% did not show self-injury. So I think there was 47 of the 79 didn't show aggression. That's the blue. So the blue is the people who just didn't show either aggression or self-injury. The kind of red and the pink color are the people who did show these things. So there was some aggressive behavior in 32 out of the 79. And what the dark red is that 8 years later, the proportion of people where they still showed some degree of aggression or self-injury. So there was pretty high levels of persistence, actually. It's about sort of 66 to 70% persistence. They found that impulsivity, people who were more impulsive at baseline, tended to have more likely to have persistent aggression when they were older. That to me makes me think about sort of treatments for things like attention and impulsivity and so forth to try and reduce them if it's possible. Self-injury was predicted by repetitiveness, by more of these kind of autistic-like repetitiveness, predicted persistence. So it's the other way of looking at these is that about a third of people don't show these behaviors over the course of 8 years, but about 2/3 do continue to show them, 2/3 to 3/4. One thing they didn't do particularly is they didn't really look at the change in severity. So we don't know whether or not the severity is the same, worse, or better. So it might be that people still show these behaviors, but that they're a bit worse, or they might be a bit better. They didn't really look at that. And it was still in a reasonably young adult group, although they had a reasonable degree of spread of age. But it would be, again, interesting to know as you move into 30s, 40s, 50s, whether these things persist. Okay. I'll talk a bit about health. What we do know about health in Fragile X as people get older. So these are just a couple of things that are common in Fragile X syndrome. People will be aware of that they exist. Things like mitral valve insufficiency. So people can have problems where one of the valves in the heart, it's quite common, just doesn't close in quite as effective a way as it would in typical developing people. Almost all of the time, it doesn't cause any problems. We hear these murmurs in people. You listen with a stethoscope, you can hear a kind of, it's called a pansystolic murmur, but you can hear the heart murmur, and it's just the blood disruption in the kind of blood flow. Doesn't cause problems. It's reasonably common in the general population as well. It's probably the most common valvular thing that we hear. Most of the time, it doesn't change with age. But it's probably worth knowing that in some people it can. If you care for someone, if you look after someone who's got Fragile X, who starts to get more and more short of breath on exertion, getting very tired, can't do things, it's worth getting their heart checked. Because it could be that it's the change in the mitral valve.
Is that full mutation?
This is all in full mutation, so I'm not talking about pre-mutation here at all. That's because I'll mention about not getting confused with FACS for some stuff later on. So this is all in kind of full mutation individuals. And actually the deterioration of the mitral valve with age is just something that happens to anyone who's got a mitral valve problem, so it's not specific to Fragile X syndrome. But it's very common in Fragile X that people can have these valvular changes. Epilepsy usually gets... Yes, male and female will be less severe, less prevalent in females because of the protective X chromosome, etc. But it's present in both. I don't know if you asked that side. Yeah?
What age would a male be tested for their heart valve?
So it's the sort of thing that can be picked up on with a stethoscope. So
Because I was told that it doesn't develop until teenage.
Yeah, so it would usually come through in about the teenage years. If you had it checked when they're a child and there's been nothing there, it can come through it comes through in teenage years, and it then tends to remain reasonably stable. So they should get checked. I I would be interested to hear what people's experiences are as to whether they are actively being checked for that, or whether they maybe have to ask, or whether it turns up coincidentally because they brought their child to the GP for something else. But they do. It's the sort of thing that can be turned up on a stethoscope and can be checked pretty easily with an echocardiogram. But in most people, they won't even need an echo. They'll quite often just check it and keep an eye. If you're not displaying any symptoms, it's nothing. It's easy for me to say there's nothing to be concerned about. These are very common murmurs in the older population more generally, very common heart valve changes that we don't make any kind of, we don't follow them up necessarily, even in the general population. But if something changes, someone's getting more tired, they're getting more out of breath, it's worth getting it checked. Epilepsy tends to get a bit better as people get older, but there is some people where you might start to see seizures emerge in adulthood. Not many, but there is some. Sometimes people start developing little absent seizures as they move through adolescence into adulthood. Sometimes it's that they haven't really been noticed before as well, actually, but there is this, it's worth keeping an eye on. Seizures in Fragile X respond well to treatment, usually. Not for everyone, but they are at the more responsive end of all of the conditions and things that we see. But it's, again, something to keep an eye on. Heartburn, reflux, all of the other things associated, and people get ear infections, so those kind of things continue. Think about them and treat them is what we say to people, because, they can cause, if somebody seems to get a bit aggressive a bit after they eat, 20 minutes after they eat, and they seem to be upset or anxious, whatever, think about heartburn, those sort of very basic physical health things which are eminently treatable, which might actually lead to quite dramatic improvements in how people feel and their behavior. So, do any physical health problems emerge with age? So this is something to be clear about. FACS-TAS doesn't generally occur in Fragile X syndrome. There are some very, very rare cases where people would have a mixture of a full mutation and a pre-mutation where they may be at risk of developing some of the features, but it's pretty rare, described in case reports. Generally speaking, FACS-TAS is a condition associated with the pre-mutation. That being said, there was one study in the US done by the Mind Institute where they did find that some people with Fragile X, as they got older, developed a tremor, developed some Parkinsonian features, Parkinson's-like features, so stiffness and tremor. However, as I'm sure you know, they're much more likely to be treated with antipsychotic medicines in the US, risperidone and so forth, which some people might be on, very good for when people get agitated and angry, but they can cause Parkinsonian-like features in some people. They tend to go away when you stop the medicine, or you can give other medicines to help with those side effects. So they commented on this study. They said they found that some of the adults, as they got older, had started getting a bit of a tremor, started getting some stiffness. It wasn't to do with FACS-TAS, and they think it might have been medication-related. But I mentioned it just so people are aware. As you would with anyone, if one of your relatives starts to develop quite a tremor and get stiff and drop things, you take them to the doctor anyway and get them checked out. And you would, if they did have these sort of features, they would get treated as they would for the general population. It's not like there's anything different or fancy. But FACS-TAS itself doesn't generally occur in Fragile X. There's one or two rare cases where it might, because of the way the genetics are, but it doesn't generally occur. And life expectancy is broadly normal. There's not, as far as we know, I'm caveating everything, I'm sorry, but as far as we know, there's not really any major physical health problems associated with getting older in Fragile X. Mental health. Anxiety. Anxiety is common, full stop. Anxiety and Fragile X, I don't need to tell you guys. It is one of those things that I think people probably is, I can't speak for folks, but it's one of the things that I think often causes people the biggest limitation in people's lives and makes it most difficult to access the community and do things that people, that people want to do. You could do a whole talk about anxiety and mental health and Fragile X syndrome. For some people, those anxieties emerge more in adolescence and adulthood. there are ways to think about these things. There are things to think about in terms of triggers, in terms of maximizing routine, communication, etc. Some people benefit from a small amount, usually very low doses of medicine. It can be helpful for some, usually just what we call SSRI medicines that we would use for anxiety in the general population can be useful for some people. But it's very prevalent, and I don't think I need to tell people that. We don't know whether it gets better or worse with time, because that's one of the questions people say, is my child always going to be quite as anxious as this? We don't have good research evidence in that kind of field, to be honest with you. And that's partly why I say I think speaking to family members and getting sort of lived experience is quite useful for some of these things. There's no evidence that any other mental disorders are increased. So there's no increased rate of bipolar, schizophrenia, particularly depression compared to other people with learning disabilities. So it's mainly focused around anxiety. Again, no one's looked in super great detail at these things, but as I say, there's no reason to think that children will necessarily become more mentally unwell as they move into adulthood. It's not a risk factor for these things. And I think particularly important to let people know is this paper from Denmark, I think, which was done a year ago, which says no increased risk of dementia in Fragile X syndrome, as far as this paper can tell. So this is Down syndrome. So Down syndrome has a massively increased risk of Alzheimer's disease as people get older. This is Williams syndrome, which seems to have a slight increase. This is Fragile X, and it is just runs basically flat. So they did not find any increased risk of dementia in adults with Fragile X syndrome. It's not a big study. Things may change over time, but it's slightly reassuring for people to know that, this isn't reassuring for anyone to know, 1 in 20 of us will develop dementia over the age of 65, and 1 in 5 will develop dementia once we get to about 80. So it's a very common condition. There's no reason it can't affect people with Fragile X syndrome, but they're not at an increased risk compared to all of the rest of us. So, as far as we know. So, I want quickly just talk some practical things in adulthood, things to think about. And this is just based mainly on clinical sort of experience, people I see in the clinic, both with Fragile X and people who have an intellectual disability who don't have Fragile X. Things that tend to cause problems. I've got more of a list of things to think about than I do wonderful solutions, it has to be said. I refer you to the Society's helpline. I'm saying that, and the way I say it sounds like I'm joking, but actually, people manning that helpline have lots of experience and it's not, I genuinely work in an ivory tower, which is slightly annoying, but as an academic working in an ivory tower, I do work in a clinic, but the people who've got the most experience of these things in Fragile X syndrome work with the Society and are people in this room. So that kind of knowledge is very, very valuable. Transitions. Again, it's a whole talk in and of itself. We all struggle with transitions, and times of transition can be times of high anxiety. There are also times of opportunity. They can be times to reflect on things that have gone well, and times to kind of think about or move forward into the future. But they are difficult times. Very basic advice. Start planning early. 14 years old. I do not work in England, but as far as I understand, looking at the legislation, there's a statutory duty to have a Year 9 review for everybody with the HCP or a statement, to start thinking about transitions. I hope that happens. This is about discussing with schools, with local authorities. Think about what they're going to do, what the person is going to do after they leave school. It sounds so obvious, and everyone, it's not so easy. But are they going to go on to college? Are you looking at supported work? Is there activities they can get to? Is there even day centres or whatever? How are they going to get there? They've previously been going on a bus to school or things, but now they have to go to a different town because that's where this is. How are they going to manage that? There should be assessments by social care, by the local authority, about whether there is support that is needed. This is all in an ideal world, I will say. I'm sure people have had varying experiences with services. There should be discussion about transitions between healthcare services. A lot of people will have some input from a pediatrician when they're younger, at very least, that they'll be aware of them and so forth. Once you get to adulthood, there is no service like that. People who have got maybe some behavioural issues or mental health issues might move to adult learning disability services, but the vast majority will probably be GP and get in touch if there's any problems kind of care. But there needs to be that transition between services, particularly for people with particularly complex needs. Think about money. Benefits change, all of that stuff starts to come in. It's a nightmare. The government changes the system all the time. You can get very good advice about that online and from the society about all of these benefits. And think about decision making. This is a bit different in Scotland than it is in England. So in Scotland, where I work, it would be very common for someone to apply for and get welfare and financial guardianship for their child. So it's a formal thing which says once this child reaches 16, I can now make decisions for them. And you go through courts, it goes through solicitors and courts. As I understand it in England, it's more of a slightly less formal system based on best interest meetings. But sometimes if you disagree with what other people are trying to say that happens, you may need to go and look at things like court of protection and look for orders for these side of things. But think about who's going to make those decisions. Who do you want involved in best interest meetings? I thought I had a different slide next. I'll talk a bit. I mean, one thing particularly as people get older, nobody lives forever, as we know, and it is very important to make those sort of plans, but who's going to be involved in care and things in the future, and make them early. And I'll emphasize that again. It's not rocket science. Activities are key. We all benefit from a degree of routine or structure in our lives. We all benefit. Sometimes I do not feel like getting up in the morning, but I do because I have a job to go to. Once I start getting ready for that and get out for that job, I feel fine again, and off I go and keep going and going. No, but it's very good. It keeps you in that rhythm of life and in that routine, and that is the same for people with Fragile X. You need to have a balance, fun things people enjoy, Not saying everybody needs to be working hard all of the time, but thinking about activities which give people a role, give them some kind of value, give them a feeling of accomplishment, of being a part of something. That is so good for your self-esteem, and I think that's sometimes a bit lost when you go through social care, who try, but they say, oh yes, well, there's this, they can go and, they can do arts and crafts at this place, which can be really nice and fun, but they need to make sure that it's something that is particularly about giving someone a role or feeling a part of something is good. You can get self-esteem from arts and crafts, I should say, building something, making something, that sense of accomplishment is good. But I think feeling a part of something is important for people as well. I'm not basing this on evidence, I'm just saying as clinical sense, and the people who I see, who I think do well. It is important to have fun now. This is a whole other talk about relationships, by which I mean essentially romantic relationships, getting a partner. As people with Fragile X gets older, it's absolutely natural for them to want a partner. They have these feelings, there are all of those hormones through adolescence, and people want that kind of care and love and affection and attention. Not everyone, but some do. I think, like I said, it's a whole other talk in itself. There's some very good resources if you're in this sort of situation from the British Institute of Learning Disabilities. Talks a lot about relationships. There's a lot of easy read material. I think understanding the individual is really important, understanding what they understand about appropriate and inappropriate behavior themselves. You don't want people getting into bother, but also you want to protect people about what's appropriate and inappropriate to other people. I think this is particularly pertinent sometimes for families with girls with Fragile X who may have some difficulties, but maybe not with kind of full intellectual disability, who may kind of present in some ways more able than they actually are. So understanding these kind of things, understanding where someone is at and what can be done to help them is key. Now, for folks with a learning disability, we who work in learning disability services, psychology, will quite often do these kind of assessments. That's not necessarily always easy to access. It would involve going through a GP or going through the local authority and social care, because social workers are kind of aware of these things as well. But even yourself, working out what's appropriate and understanding what your child or your adult relative understands is really important. And the longer-term future, this is the most depressing part of my talk. As I said earlier, we don't live forever. Some of the most difficult things that I do as a clinician is having someone admitted to our inpatient ward. This is not necessarily for Fragile X, this is learning disability, or even people with autism who don't have learning disability. They've lived with their family their whole life, and then someone has got ill, and then the system just collapses, and there's not been any plans made about support in the future. And it's very traumatic for the family, it's very traumatic for the adult with intellectual disability. So think about plans, I'm sure, and think about them now. And, it's easy to put these things off, but it is, think about yourself. What happens if you get ill? What's that person going to do? Who's going to look after them? Who's going to kind of keep an eye on things? Who's going to look after your cat? Are you going to leave it up to your child to stress about? Or, all of these sort of things are important. I don't know if anyone has hospital passports, but thinking about what somebody needs themselves, if they were to get ill and go into hospital, or maybe, God forbid, maybe people have an accident or something like that, having that kind of information there. We can put it, I don't know what the system is around the country, but certainly there are systems to put that on electronic health records in Scotland so that it's there, it flashes up as a, pardon? It's basically a description of what things, it's a kind of brief summary about the person for if they had to go into hospital, and it's got things like, I have Fragile X syndrome, I may have struggled with sensory things, I'll struggle with these kind of bits and pieces of, so it's to give a bit of care information. There are template ones that are online. I think it's something you can take to your GP or local authority. Either of them should have systems where they can get them into the right sort of places. He says optimistically. I'm talking, locally speaking, we get people, they do them often with advocates, so they do them with their social workers, support workers, and then they get given into GP surgeries and uploaded onto health records.
Just to say, some hospitals, in Guildford, you can work with a learning disability nurse in a hospital to develop an hospital passport and everything.
Yes, so there will be, and it will differ, probably similar, learning disability liaison nurses are increasingly common in hospitals, and they're very helpful people to get to know. In the future, if you do, and services should know, and this is the thing, but it's worth asking, is there a learning disability liaison nurse if your adult child does have to go into hospital? Yeah. So it should remain filed and it should remain with them. But the chances are that you'll have to give it to someone, because they won't necessarily dig it out. Where we are, they will put these things now on like electronic healthcare systems. They now will upload these sort of things, but as everyone knows, the NHS IT system is not linked up in any way, so just because it's uploaded in one area doesn't mean it will be in another. I think it's worth having a paper copy of it and presenting it. And it's really helpful. If you work in a hospital and you're a nurse and you have someone with Fragile X and you don't really know anything about it and you get given some information about the condition but about that individual, it's very helpful for them. So yeah. Oh, I'm getting a hassle. I'm almost done actually. I think this might be my last slightly depressing slide. Plan for long-term accommodation. Plan for long-term care issues. As I say, think about who's going to be involved in decision-making with the person. I don't say for, but with the person as they get older. I was speaking to a colleague, Andrew McKechnie, who wrote that article for the British Journal of General Practice, and he was saying it's actually as well, these can be quite positive conversations to have with relatives, actually, and it helps to kind of make sure, because maybe you're having to talk to another family member, an aunt or a brother or sister of the person, and they may have been worried about it as well. What's going to happen? So having these conversations can be quite positive, and it helps to keep everything clear for people about what's going to happen in the future. I think planning for long-term accommodation early is a good thing as well, and I think most people agree with that. But no, not leaving it until, if someone lives with you, if you leave it until you cannot cope anymore, it's much harder, and oftentimes things get forced upon you and that person then because you're ill and you can't manage things, whereas if you make that plan early, you have more input into that process. And that's just my general kind of clinical experience that we see. But these things are hard. I mean, I say this as if it's dead easy. I know it's hard to do, and I know I see families who are saying, I've had families who say to me, we will care for her until we are no longer able to do so. And that's where they're at, and that's fine. But I would advise people to think about these things.
Just to add to that, there's a very really useful book called Chris Hadfield's Astronaut's Guide to Life on Earth.
Okay.
He talks about the whole thing about how he's planning for the future, and then talk about if he dies, what happens. He just says, right, plan for every scenario, talk about every scenario, makes it easy for everybody to think about. So it's really, really good.
Okay.
It's very similar theories.
What was it called? Astronaut's Guide to
Life on Earth.
Astronaut's Guide to Life on Earth. Yeah. Okay. I think you can't plan too much, to be honest. Lots of resources about adulthood. I couldn't get onto the Cerebra website last night to check that their transition guide was still there, but it used to be, but their website was down. But there are lots of resources out there. The Fragile X Society is a great place to start. And just to mention, coming soon, I talked about how there's not a lot of... we have a sort of a follow-up study in Edinburgh looking at people with Fragile X that we've started off. It's been quite small so far, but we're just in the... Sonia Campbell, who is running it, is just in the process of redesigning it all, alongside some members of the society as well, who are having input into how it's going to look, what it's going to do. The idea behind it is trying to get this sort of information with people with a sort of long-term view. As we gather, people join, they fill out a questionnaire, and then we will recollect the information in years to come. I would hope that we'll be able to link it up with some of the other work that's going on around the country in this regard, because otherwise people will be doing lots of different questionnaires, and that's something I think we need to be aware of as researchers. But just to let you know that it may not look exactly like this. This is a stock photo, but it's going to try and be a slightly user-friendly website where people can go and can fill out bits of information and things about themselves and about their family, about physical health, mental health, and that kind of thing. I hope so, because it is being co-designed along with a group of people from the society. Sonia is a sort of focused group of people that she is interacting with on a regular basis. So I would hope that we would be able to put it, it would come out through the magazine and things like that will let people know. And I'd encourage people generally, I know you're busy, but I would encourage you, as I think you said, to take part in research studies, because it is how we learn. I know fine well that I don't always volunteer for things that come up, so don't feel you have to volunteer for everything, but if something comes through the door and it piques your interest a little bit, get in touch and see. And I encourage for everyone, for the studies mentioned earlier and other things, because all of these are all aiming to try and increase our knowledge and answer some of the questions to which I've had to say today, I'm sorry, I don't know. So, and I think that's me. Thank you.